Hello, my beautiful people. Um, this is Sylvia coming at you once again with my testimony. Um, with my testimony, okay. Um, Tonight I'm going to talk about the end-stage renal failure disease. Okay. End-stage renal failure simply means your kidneys don't function. They no longer clean the toxins, poisons out of your body, and you barely urinate, okay, to get rid of the fluid. So, dialysis is supposed to help you do all those things, okay. Now, when I found out, it took a little while for them completely shut down, because after I was on the heart medications for so long to prevent rejection, I started exhibiting a decrease in functionality in my kidneys. Okay. They started to fail. And even though the doctors knew this, they did nothing until I got down to my kidney function, got down to like 20%. Okay. Now, I'm not saying everything is their fault, because I could have took time out, did research, and investigated. But see, that's how the enemy gets involved, to keep you ignorant so that you don't know what it is you need to do when you're diagnosed with something that serious, especially when he is trying to kill you. Okay. So, and to go back to the COVID, actually, the COVID caused my kidneys to completely fail, because once I went to the hospital, they inserted the catheter in my chest. Yeah. It was a tube that was inserted to the right side of my chest, all the way to the left side, because of the heart transplant. My heart is on the left side of my chest, not in the middle, not in the rib cage, like most people, okay? So they put the catheter in. I woke up, and they told me what happened, okay? Now, the strange part about it is that I don't remember giving them consent, but I'm pretty sure my family did. I probably wouldn't have refused it, because, I was still worldly, was not as spiritual, and didn't know the Heavenly Father had been healing me all along. Okay? I would have did what most people would do to save my life. Okay? So I'm in this hospital, and, like I said, they put the catheter in. So when I went to the rehabilitation center, I got dialysis there. I started out doing 4 hours every other day. At that time, my schedule was Monday, Wednesday, Friday. And I did that, and they got a lot of the fluid off of me. So by the time I left there, I only needed 3.5 hours of dialysis. Okay? So imagine you sitting somewhere for 3.5 hours, your arm in one position, can't move it because the needles might come out. Yeah. Even though you have a TV, you can have your cell phone, all that. Just sitting there for 3.5 hours when you're thinking about you could be doing so many other things. Okay. um, and I understand why now a lot of people would cut their time. Yeah. Okay. But let me get back on track. So, like I said, did the dialysis with the catheter. The one thing about having a catheter, there are much more severe risk because you have a tube that is inserted into your heart. So the risk of infection is great. But if you have good techs and nurses, well, the nurses actually, they will clean it for you thoroughly before and after treatment. Okay. And because it is in your heart, they do give you a blood thinner called heparin. Okay, because heparin will evaporate out of your system like pretty much immediately. It doesn't linger like a Coumadin or warfarin. Okay. So they would give you a shot of that and clean you up thoroughly, put dressing on it, and you're advised not to get in the shower, to get it wet. Okay. Believe you me, I'm not like just wash up and go girl. I have to get in the shower and wash everything. So I made ways so that I can maneuver not to get that port access catheter wet. Okay. I mean, you could do all sorts of things. You could put like water resistant bandages on it, that sort of thing. So I had that for a while because originally when I got the surgery to put the access in, it didn't work. Another attempt. Another attempt by the enemy. It didn't work. So we kept trying to get it right. For some reason, the communication between the dialysis center and my vascular doctor, they were never on the same page. Okay? They were never on the same page. But this is the mercy and grace of the Father. He made it happen that they were eventually on the right page. And so I was able to have the catheter removed from my chest, and they were able to use the access that was put into my arm. What they do when they put the access in your arm, they put this access, it's called a fistula, in your vein. Okay? And it's there all the time. And you could feel it thrilling like a little machine because the blood is flowing through it, And it does feel a little bit warmer in that location, okay? Because like I said, it's almost like a machine that's in your arm, but it's the blood flow. And I think it's just some sort of tubing that's in there, okay? So this access allows them to insert needles into your arm. They insert them in what they call a venous vein and an arterial vein. So you got the blood flowing out into the machine to be cleaned, and you got the blood returning in from the machine that's cleaned, okay? And so this access, boy, the devil is busy. The enemy is busy. Sorry. Some notification popped us up. Actually, it was a false prophet YouTube video. Okay, that's why I said the enemy is busy. Picture that. Anyway, but to continue on, yeah. So that's what the access is for, and what and how it works, what it does. Okay, and the access, my access, it was never like I could actually get have the needles removed and get bandaged up and walk out the door. Excuse me. See, when you have a catheter, you don't bleed out. Once that connection is removed from the machine, the blood stops flowing. Okay? So you don't bleed out. It's very quick. That's the one thing I really liked about it. I didn't have to sit there for 30 and 45 minutes or an hour waiting for my chest to stop bleeding. Okay? But with the access, I had to do that several times. One time, it happened so badly that I had to go to the ER. They placed 2 tourniquets. And I don't know if any of you ever had a tourniquet on you. But picture putting your arm in a vise and someone turning it all the way until it can't be turned anymore. Okay? And my arm still did not stop bleeding. Another attack of the enemy on my life. But the Heavenly Father's grace and mercy and the purpose that He has on my life, okay, He saved me once again. Like I said, I could have died many times, but that was not my destiny. Okay? I bled so badly, all over the floor, all over my bed, in the house, in the ambulance, in the hospital, for a while, until one doctor who was sent by the Father in heaven came in and put stitches where they had inserted those needles. Stitches after suffering 2 tourniquets that did nothing but help push the blood out more. See, I could make a lot of money suing people. I could have sued that ambulance company. But I know it wasn't them. It was the enemy trying to kill me once again. Okay? So I don't take pleasure in suing people, or companies, even though they may deserve it, the companies. But I think about people needing their jobs to feed their families, to take care of themselves. I'm not selfish like that. If I am to be wealthy or, have enough money to take care of me and my family, the Father in heaven will provide. Okay? That's why I don't accept sponsorship. I do not monetize the YouTube channel, Lady Samson. I don't get anything for it. Posting on my social media platforms. Okay? Just to make that clear. Okay? So, like I said, the Father in heaven sent me the one doctor who simply stitched up those two areas where the needles were inserted. Now, the odd part about it is that those weren't the only two areas that were bleeding. I didn't have needles inserted anywhere else except for those two spots. But for some reason, and of course, I am now knowing, because the Heavenly Father is telling me, that the enemy caused additional parts of my skin to break and bleed. Okay? What I was doing spiritually at the time, I don't know. Because the Father in heaven will not allow the enemy to attack you unless he needs to give you some sort of correction to make you get back on your path. Okay? So, yeah, that's what happened. And when she got done stitching and sewing all these bleeding areas near my access, it looked like some sort of quilted patchwork. No rhyme or reason. It just did. So I was able to go home after a while. Once they were secure in knowing that the bleeding had stopped. Okay. Went back to the dialysis center the next day. I think it was the next day. I'm not sure, because I may have taken no, because it wouldn't have been the next day, because the day that I had dialysis that day when I went into the emergency room. Okay. So I didn't go in. I was able to rest from all that drama. Okay. And also, while I had that day of rest, I also realized that the tech that put me on the machine, took me off the machine, every time I had this person, when I got home, I would always bleed. Out of the 3 years or more that I was at this dialysis center, I don't think I ever had another tech that caused me to do that. Okay? So, the Father enlightened me. I didn't know it was him at the time, but it was him. He had me think back and say, okay, who has this happened with before? It happened on 2 other occasions besides this one. Not as bad, of course, but it happened. See how it's the less of me, more of you. Some people have more of themselves than they do of the Heavenly Father in them. Okay? I'm going to leave that at that. So, yeah, he helped me to realize that. So when I went back to the dialysis center, I said to the nurse, I don't ever want this tech again. As long as I'm coming here, I don't want this tech. And so they put it in their system and noted it. And I made sure that if the tech that normally handled me, who was very patient and very nice gentleman, shout out to my boy. Hopefully you'll see this video. You know, I really liked him because he, like I say, he's patient. He's very funny. He knows what he's doing. He knows his stuff. Been there for a while. Been in the field for a while. So when he's not there, or he's on a different schedule, they will substitute with someone else. I made sure when he told me that he was going to be out, that she was never my tech. Even though I told him and it was in the system, I made sure, I double checked it. Double checked. Because sometimes people forget, systems break down. No, I wasn't going to hear that. So, of course, they did not let her go. They don't let you go because they say, well, she's on multiple blood thinners, and you know she has this clotting issue. So they didn't let her go, and I don't even think they mentioned anything to her because she was very cordial after. Okay. Still very cordial after I told them that. Towards me. I harbor no hatred. Like I said, it's not the tech's fault. More of me, less of you. She has more of herself and less of the Heavenly Father. Okay? So just to continue on. So after that happened, you start to really watch everything that goes on. You watch everything that goes on, and they do require, or they do suggest that you go to see a vascular doctor every 3 months. Okay, the vascular doctor is the one who puts the catheter in your chest and they access the fistula in your arm. Okay. The reason they tell you for the checkup is to make sure there's no clotting in there, that there's no issues with insertion of the needles, that sort of thing. So what they do is they take and insert a little camera in your vein to take pictures to make sure there's no blockages, there's no constriction of veins, because if there is, they can take care of that right away without you going under anesthesia. Yeah. You might feel a lot of pressure because they're inserting balloons and stents in your tiny veins and, opening them up. Okay. I've had to have that happen multiple times. Okay. Not that, I have a lot of blockage or clotting in my veins, but because it never quite worked originally. Yeah. It never quite worked originally. And we know why. Because of the enemy. Still trying. Okay? So, this last appointment that I had, right? I had swelling. A lot of swelling in my left arm where the access is. And it blew up like 3 times its size. Okay. So my original vascular doctor, he has a lot of patients. There are so many people out there looking for kidneys. If you are not a donor and you want to be, just sign up. Okay, sign up. There are a lot of people waiting. A lot of people, especially people with O blood types. Okay, yeah, and I went. I was like, okay. I told my doctor at the dialysis center, this is what's going on, and he looked at my arm and he kept looking at it and kept looking at it, and he's like, okay, Miss C, I want to recommend that you go see this doctor, okay? And I was like, and he got me an appointment like in a day, and I was so grateful. So I went to this new doctor, and he took care of it. My arm went down immediately. Even while I was sitting there waiting for the hour to pass to make sure that I was okay. Yeah, that quick. And, I was so happy. I was so impressed and everything. Do you know that the fluid ended up in my left breast? A lot of it. Yeah, that stuff flows from your arm to your breast to, wherever. Yeah. I'm not going to show it to you perverts, okay? But anyway, you get the idea. So once I saw that, I went back, and after, of course, telling my doctor at the dialysis center, and I told him, I said, well, look what happened. And he said, we can't do anything about that. He said, all I can do is advise you to wear sports bras at night, and to keep a bra on 24 hours. Now, ladies, as soon as you get in your door after work, you take your bra off. Maybe after you kick off your shoes, but that's the next thing that's about to go. You know what I'm saying? So I was not happy with that. And I was not happy with the fact that they could not remove the fluid. Okay. What it was explained to me by another doctor was that the fluid was all over. It wasn't like, it didn't, how do you say it? It didn't congregate in one area. If so, they would have been able to kind of stick a needle in there and draw out the fluid. Okay. So I have to suffer. Really suffer, because a sports bra is really, really tight. But it does support. Okay. So the whole point of wearing the sports bra was to kind of have the fluid flow back through the arm and out wherever it's supposed to go, wherever the veins carry it. Okay. So yeah, that was another attempt by the enemy. It didn't kill me, but it could have, because your breasts are near your heart, of course. Okay? But that's the grace and mercy of the Father. He didn't allow it to happen. He saved my life. Once again, the Heavenly Father saved my life. Okay? So, after that happened, I went back recently before I stopped dialysis. I had them look at my access twice. Okay? Because my arm had begun to swell again, and the machine read that the flow was too high. Now, this was after the vascular surgeon put in a new stent actually a larger balloon. And yeah, because um, to help like the blood flow better through the access when I'm hooked up to the machine. And so I went in for that, and then a couple of weeks later, that's when I noticed the swelling in the arm again. Okay, so I told the doctor at the dialysis center, and he said, "Well, we'll send a referral. I need a referral for this doctor because he's not associated or affiliated with my main my main hospital, I would say, because the majority of my doctors were affiliated and a part of the same hospital. Okay, he was outside of that, out of network, I guess you could say. So I needed a referral. So they sent him the referral. Okay, on the referral it says high volume flow, something to that effect, meaning that my blood was flowing too high, and therefore causing me to bleed a little longer, after they take out the needles from the access. Okay, so that's what they wrote on the referral. I never said that, and I didn't even know it until I got to the appointment. And so the father had me have a conversation with the doctor, the vascular doctor, because he felt like, he knew that he didn't know the real reason I was there. And so I told him before he did the procedure, he said that it's not written on your referral. I said, well, that's my complaint. Okay. So whatever ideal he had in mind of what he was going to do once he got in my arm totally changed. Okay. Totally changed. So he removed the stent and the balloons that were in there and put in a smaller size so that it would reduce the volume and also to help alleviate the swelling in the arm, not the boob. Yeah. So I'm going to leave it at that because this video is long enough. But we will continue tomorrow. And I just want to say good night. Be blessed. Love the Father in heaven. Love one another. And don't let the doctors just railroad you into a diagnosis, into taking medications without being informed first. And you will have to do that on your own. Okay? Just Google everything. Google everything. And try natural herbs and remedies. Because they are available. If you go to my Facebook, which is Sylvia C., that is SYLVIASEAY, you will find recommendations on how to clean your vessel and those herbal remedies. Okay? Herbal remedies for all diseases, even cancer. Okay? One love, one Father in heaven, and one people. Good night.